Hi, I'm Alicia. I want to talk to you about breast cancer. I'm sure a lot of you have already heard of the disease, but there are many risk factors and facts about it I'm sure you haven't heard. For example, it affects men and women. Caucasian women are low likely to die from it than black women. 78% of all innovative breast cancer diagnoses occur in women age 50 or older. Women in their 40s account for only 70% of the diagnosis. However, breast cancer can and will strike women of any age. Breast cancer is cancer originating from the breast tissue. Worldwide, breast cancer comprises 10.4% of all cancer incidences among women, making it the most common type of non-skin cancer in women and the fifth most common cause of cancer death. Breast cancer is about 100 times more common in women than in men, although males tend to have poorer outcomes due to delays in diagnosis. Prognosis and survival rates vary greatly depending on cancer type and staging. With best treatment and dependent on staging, 10-year disease-free survival varies from 98% to 10%. Treatment includes surgery, drugs, hormonal therapy, chemotherapy, and radiation. The primary epidemiologic risk factors have been identified are sex, age, lack of childbearing or breastfeeding, high hormone levels, race, and economic status. A 2007 report by American Institute for Cancer Research and World Cancer Research Fund concluded women can reduce their risk by maintaining a healthy weight, drinking less alcohol, being physically active, breastfeeding their children. Several studies lead their children. Several studies have found that black women in the U.S. are more likely to die from breast cancer, even though white women are more likely to be diagnosed with the disease. A risk factor is anything that increases a person's risk of getting a disease. Different cancers have different risk factors. One risk factor is getting older. Your risk for breast cancer increases as you age. About 77% of women diagnosed with breast cancer each year are over age 50, and almost half of them are age 65 and over. Having a mother, sister, daughter, or other first-degree relative who has breast cancer puts you at a higher risk for the disease. Having your first child after age 35 or never having children puts you at a higher risk. If you begin menopause after age 55, your risk increases. A family history of cancer in the ovaries, cervix, uterus, or colon increases your risk. Your risk increases if you get your period before age 12. Use of alcohol is linked to increased risk of developing breast cancer. Compared with non-drinkers, women who consume one alcoholic drink a day have a very small increased risk, and those who have 2 to 5 drinks daily have about 1.5 times the risk of a woman who drink no alcohol. Caucasian women are a slightly higher risk of developing breast cancer than African American, Asian, Hispanic, and Native American women. The exception to this is that African American women are more likely to have breast cancer than Caucasian women under the age of 40. Being overweight and excess calorie and fat intake increases your risk. In 2004, breast cancer caused 519,000 deaths. Worldwide, 7% of cancer deaths and about 1% of all deaths. The risk of getting breast cancer has increased over the years. In 1940, the lifetime risk of a woman developing breast cancer was 5%, or 1 in 20. The American Cancer Society estimates the risk being 13% in 2009, or almost 1 in 8. There are several organizations that support the research for breast cancer, which include Yoplait, American Airlines, Ask.com, Bank of America, Ford Division, New Balance, Athletic Shoes, and Remax. There are several things you can do to help the cause, which are donating funds, becoming an activist, participating in events, and buying products whose proceeds go to finding a cure. One of the best things you can do is support. Men and women who are diagnosed with breast cancer feel trapped and alone. They may not even tell anyone of their diagnosis. So if you know anyone with breast cancer or you know of a support group, support, volunteer, help find a cure.